Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pelvic pain. Introduction. Pelvic pain is pain that is felt mostly in the lower abdomen or pelvis area. The pain may be experienced differently depending on the cause. If the pain is severe, it might get in the way of your daily activities. You might have to undergo a lot of medical tests to find the cause of the pain. The treatment will depend on the cause, how bad the pain is, and how often it happens. This program explains pelvic pain in women. It discusses different causes of pelvic pain, medical tests used to diagnose pelvic pain, and treatment options. The pelvic organs. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The pelvis also contains other organs of the urinary and digestive systems. Structures of the urinary system in the pelvis include the ureters, the bladder, the urethra. The bladder is a hollow organ in the lower abdomen. It stores urine. Urine passes from each kidney into the bladder through a long tube called a ureter. Urine leaves the bladder through a shorter tube called the urethra. Structures of the digestive system in the pelvis include some of the small intestine, some of the colon or large intestine, the appendix, the rectum and anus. Pelvic pain. Pelvic pain in women is a term used to describe pain that happens in the abdomen below the belly button. It is a common reason why women seek medical care. The pain might be steady, or it might come and go. Severe pain may make it difficult to do certain activities. Pelvic pain can also be a sharp and stabbing pain felt in a specific spot, or a dull pain that is spread out. Some women have pain that happens only during their menstrual periods. Other women may feel pain when they need to use the bathroom, and some feel pain when lifting something heavy. Pelvic pain is considered chronic if it lasts more than 6 months and affects a patient's quality of life. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Pelvic pain can be a sign that there is a problem with one of the organs in your pelvic area. This organ could be a reproductive organ, such as the uterus, or another organ like the intestine or the bladder. Pain also can be a symptom of an infection. Some possible causes of pelvic pain related to the female reproductive organs include endometriosis, pelvic floor disorders, uterine fibroids. Endometriosis happens when the tissue that normally grows inside the uterus grows somewhere else in the pelvis. It can grow on the ovaries, behind the uterus, or on the bowels or bladder. This can cause pain and infertility. The pelvic floor is a group of muscles and other tissues that hold the uterus, bladder, bowel, and other pelvic organs in place. Pelvic floor disorders happen when the pelvic floor becomes weak or injured. These disorders can cause pain as well as trouble with bladder or bowel control. Uterine fibroids are non-cancerous tumors that grow within and around the wall of the uterus. Symptoms can include heavy or painful periods, pain during sex, and lower back pain. Some other possible causes of pelvic pain are adhesions, interstitial cystitis, irritable bowel syndrome or IBS. Adhesions are bands of scar-like tissue. They cause tissues and organs to stick together. They can form as a result of surgery or infections such as pelvic inflammatory disease. Interstitial cystitis is a condition that causes discomfort or pain in the bladder and a need to urinate frequently and urgently. It is far more common in women than in men. The cause is not known. IBS is a common problem that affects the large intestine. It can cause abdominal cramping, diarrhea, and constipation. Although IBS can cause a great deal of discomfort, it does not harm the intestines. IBS can affect both men and women, but it is more common in women. Sometimes healthcare providers cannot determine the cause of pelvic pain. In other cases, a woman may have more than one cause of pelvic pain at the same time. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. A physical exam will be performed. This will likely include a pelvic exam. A pelvic exam checks the organs in the pelvis for signs of disease. During a pelvic exam, your healthcare provider will check for abnormal discharge from your vagina or cervix, lumps near your ovaries and fallopian tubes, tenderness or pain in your pelvic organs. Lab tests may be done to help confirm a diagnosis or rule out certain conditions. A sample of blood or urine may be taken for testing. Additional tests may also be needed. These tests may include pelvic ultrasound, pelvic MRI, pelvic laparoscopy, cystoscopy, colonoscopy. A pelvic ultrasound uses sound waves to create images of the organs and structures inside the pelvis. It can help find abnormalities in the pelvic area. A pelvic MRI is an imaging test that uses powerful magnets and radio waves to create images of the pelvis. It can provide more detail than an ultrasound. A pelvic laparoscopy is a minor surgery that may be used to help diagnose a problem in the pelvic region. During the surgery, a viewing instrument called a laparoscope is inserted through a small cut in the skin below the belly button to look inside the pelvis. During a cystoscopy, the inside of the bladder is viewed using a special instrument inserted through the urethra. This can help your healthcare provider see if there is a problem with the inside lining of the bladder. A colonoscopy looks at the inside of the entire large intestine. It uses a thin, lighted tube inserted into the anus to find problems such as inflamed tissue or abnormal growths. Other tests may also be needed to diagnose pelvic pain. Talk to your healthcare provider to learn more about the tests you will need and what to expect. Treatment. Treatment for pelvic pain will depend on the cause, how bad the pain is, and how often the pain happens. Treatment for pelvic pain may include lifestyle changes, medicines, physical therapy, surgery. Lifestyle changes can help some women with pelvic pain. These changes can include eating healthier, improving posture, and adding regular exercise to their schedules. Many different medicines may be used to treat pelvic pain. Pain relievers, antibiotics, muscle relaxants, antidepressants, and hormonal treatments are just a few examples. Physical therapy can help with some types of pain. This might involve stretching and strengthening pelvic muscles. It may also involve learning to relax and control pelvic muscles. In some cases, surgery may be needed to treat pelvic pain and its causes. Surgery may be done to remove adhesions or fibroids. It can also be used to treat endometriosis. Talk to your healthcare provider about your treatment options. Make sure to discuss possible risks and benefits for each type of treatment.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pelvic pain is pain that is felt mostly in the lower abdomen or pelvis area. The pain may be experienced differently depending on the cause. Pelvic pain is a common reason why women seek medical care. You might have to undergo a lot of medical tests to find the cause of the pain. Tests often include a pelvic exam and lab tests. Other tests that may be done include imaging or scope tests. Pelvic pain can be a sign that there is a problem with one of the organs in your pelvic area. This organ could be a reproductive organ, such as the uterus, or another organ, like the intestine or the bladder. Pain also can be a symptom of infection. The pain might be steady, or it might come and go. Severe pain may make it difficult to do certain activities. Pelvic pain can also be a sharp and stabbing pain felt in a specific spot, or a dull pain that is spread out. Some women have pain that happens only during their menstrual periods. Treatment for pelvic pain will depend on the cause, how bad the pain is, and how often the pain happens. Treatment for pelvic pain may include lifestyle changes, medicines, physical therapy, surgery. Talk to your healthcare provider about your treatment options. Thank you for using Explain.